For my project, we're going to discuss cancer and mitosis. Well, mitosis is when cells divide, but cancer is caused when there's a mutation in the cell where the cell divides and divides and divides and there's no stopping. So it causes a tumor and eventually can cause organ failure. But today we're going to talk about vaginal cancer.
I'm like, forget you and forget him.
The vagina is actually part of the reproductive system, which is used to reproduce humans and pass along DNA. The most common type of vaginal cancer is squamous cell carcinoma, which starts in the thin, flat cells lining the vagina. Another type of vaginal cancer is adenocarcinoma cancer that begins in glandular cells in the lining of the vagina. Squamous cell carcinoma is cancer that forms in the squamous cells, the thin, flat cells lining the vagina. Squamous cell vaginal cancer spreads slowly and usually stays near the vagina, but may spread to the lungs and liver. This is the most common type of vaginal cancer. Adenocarcinoma is cancer that begins in the glandular cells. Vaginal cancer can actually be transmitted through HPV, but it can also be caused by a drug called DES that was used on some women in the 60s when their children, when they were born, to prevent them from having a miscarriage. Vaginal cancer is usually diagnosed using a pelvic exam or some sort of pap smear, and sometimes a biopsy, and sometimes they use a colonoscopy. The prognosis depends on several things: the stage of the cancer, the size of the tumor, the grade of tumor cells, where the cancer is within the vagina, whether there are symptoms, the patient's age and general health, and whether the cancer has just been diagnosed or has reoccurred. And finally, vaginal cancer is treated usually through surgery or radiation. I'm Brandy Hevel, and I approve this message.
And this was brought to you by Miss Corona and her questionable chocolate, and Brittany's popcorn.
She said vagina.
Mitosis is actually
Cut.
What? Go or
Go!
Okay.
Action!
Wait.
Apple bananas, go. Not recording. Okay,
Did you get that on video?
Do it.
This is you didn't say
I'm gonna just keep on recording. We
I
can cut.
can't say vagina with a straight face. Okay. Okay?
Okay.
Move, quick. We're getting
That way!
That's gonna get cut out. Okay. Today we are I can't do that.
Action.
What was I talking about? Stop it! You ruined it!
I wonder if they heard that. I wonder if they heard that, because Brittany and I...
again. Okay.
She said vagina. Okay, action.
Vaginal cancer can actually... You ruined it! Shut up, Brittany, seriously. Okay?
Okay.
Move. Did you cut? Using a okay. And the size of the cancer? The size of the tumor, I mean. We're done.
We like to party. We like to